Hello everyone, welcome back to my channel. I am Dr. Sushmita Singh, and today in this video I am going to tell about the arthritis. So I will discuss the type of arthritis, symptoms and causes, risk factors and how to diagnose it, and what are the different treatments which are available to treat the arthritis. So there are the mainly two types of arthritis, osteoarthritis and the rheumatoid arthritis. Osteoarthritis is the most common form of arthritis and it is a degenerative disorder that affects the joints. Meanwhile, RA is an autoimmune disease which causes the inflammatory responses that affecting the joints and the organs in the people. So mainly osteoarthritis is affecting the people of around more than 40 years of age group. Meanwhile, rheumatoid arthritis is easily diagnosed in the people below the 30 to 40 years of age group also. Osteoarthritis have different symptoms that includes your joint pain, joint stiffness, a cracking sound of the joint, or sometimes there is a severe swelling on the large joints. If we look on the causes, then cartilages at the end of the bones wears away over the time and the bony growth may develop at the joint, which is quite visible once the patient has gone for the X-ray. Now, as we say, the swelling. Because of the swelling, the people are not able to walk properly. So there are so many risk factors of it that includes your increased age, obesity, being a female, and joint overuse after an injury. So if you have any history of injury, you are almost prone for developing that. And we can treat the osteoarthritis by slight exercises, improving the footwear, pain relief medications, physiotherapy, joint replacement, and the weight loss. Now, rheumatoid arthritis symptoms are different. That includes a joint pain, stiffness that lasts longer for 30 minutes, and in this, the small joints are mainly affected, and it also includes a swelling. Now, if you look on the causes, then there is an immune system attacks the synovium lining of the joints, which causes the area to become inflamed. So this is the difference between the rheumatoid arthritis and the osteoarthritis. And let's see the risk factors. Emotional stress, smoking, family history, or being a female. These are the few risk factors of the arthritis, and we can diagnose it with a basic test that include a blood test and the X-ray. And we can treat the rheumatoid arthritis with the help of the acupuncture, painkillers, physiotherapy, as well as the disease modifying medications. So this was all about the arthritis. Thank you so much for the watching. I hope you like this video, and don't forget to subscribe to my channel if you have doubt or the query related to any of the topics that I have talked on my channel. So you can ask me in the comments or you can mail me. So thanks for the watching again, and see you in the next video. And if you need any kind of consultation related with the homeopathy for any kind of the female disorders or the skin ailments, you can call on the given number on the screen. So thank you so much for the watching.